Hello, Bindu. Glad to see you online. Let's check if our presenters have voice. So, Bindu, you are unmuted. Let's try your microphone.
Hi, Nadia. Can you hear me?
Yes, I can hear you very well. Thank you.
Hey, I was so panicked when, it popped up and said
Dear colleagues, good morning, good day, or good afternoon, depending on from where you are joining us today. I would like to welcome you on behalf of the Global Social Service Workforce Alliance to the webinar on protecting children from sexual abuse and online exploitation. I'm Natia Partsaladze, the Alliance Senior Technical Advisor, and today I have a pleasure of presenting this webinar together with Ms. Bindu Sharma and Dr. Jordan Greenbaum from the International Center for Missing and Exploited Children. Bindu and Jordan are our key presenters today, and they will provide an overview of ICMEC's work and talk about the definition and dynamics of the online sexual exploitation and the ways how the social service workforce can play in preventing, identifying, and responding to it. This topic is of the growing importance due to increasing prevalence of online child sexual exploitation in all areas of the world that have been studied. Consequently, these social service workforce representatives are likely to encounter survivors and their families and will be required to adopt a trauma-informed, rights-based approach to working with these groups. After the presentations, we will make sure to allocate time for Q&A session for you to ask your questions. So I suggest that you type in your questions into the chat box during or after the presentations. And after the presentations, I will read them to the presenters. The International Center for Missing and Exploited Children, working on eradicating child abduction, sexual abuse, and exploitation, and the Global Social Service Workforce Alliance, which is a global network dedicated to supporting the social service workforce strengthening, are members of the Global Partnership to End Violence and are committed to child protection and collective global efforts. This is why we have decided to join our forces and organize this webinar today. As many of you know, the Global Social Service Workforce Alliance, which was launched in 2013, now has more than 2,300 members. And we're working towards a world where a well-planned, well-trained, and well-supported social service workforce is effectively delivering services to improve lives of vulnerable populations. We serve as conveners and connectors of different stakeholders for collective learning in the field. So today's webinar, which is the 31st webinar organized by the Global Social Service Workforce Alliance, as well as symposia that we have organized 6 times, and some other events that the Global Social Service Workforce Alliance has supported during its existence, are aiming to connect and convene all interested stakeholders, including yourselves. All 31 webinars, including today's webinar, will be uploaded on the Global Social Service Workforce Alliance YouTube website, and you can record and listen to it. You can listen to it anytime you will find this information interesting and useful for you. In addition to convening and connecting, the Alliance is advocating for strengthening the workforce. So the annual State of the Social Service Workforce report that is now featured on this slide provides much lacking evidence in the field and can serve as a strong tool for advocating for the workforce in different parts of the world. This report, which was published in May this year, provides information on the mapping and assessment from almost 40 countries in 4 parts of the world. And you can find it online on the Alliance website. In addition to these efforts, the Alliance is advocating for strengthening for the social service workforce through different means, and some of those are shown on this slide. I will stop here with introducing the Alliance, and will invite our next speaker, Ms. Bindu Sharma, who is the Asia Pacific Policy Director at the International Center for Missing and Exploited Children, based in Singapore. Bindu chairs the Asia Pacific Financial Coalition Against Child Pornography. And she is very knowledgeable in this field and has worked for the International Center for Missing and Exploited Children for many years now. So now I will invite Bindu to start her presentation. So dear Bindu, the floor is now yours.
Sorry, I'll start again. Greetings to everyone. I know we're all in different time zones. I am Bindu Sharma, and I lead the International Center for Missing and Exploited Children's Asia programs based out of Singapore. I would like to start by thanking Natia and Nicole at the Global Alliance for the opportunity to dialogue with the social service workforce community on the issue of online child sexual abuse. ICMEC is a global organization headquartered in Alexandria, Virginia, USA, with a representation in Brazil and an office in Singapore. We endeavor to focus our efforts on the prevention, response, recovery, and healing of every child that is missing, sexually abused, or exploited, and try to make certain that no matter where they are or how they got there, no child stands alone. Next slide, please. To ensure that no child stands alone, we advocate, train, and collaborate across a diverse group of stakeholders to protect the world's children. Underlying our work is the research we commission or conduct in-house, whether it is research-based advocacy, where we seek to influence and advocate for changes in national, regional, or international legal frameworks and child protection systems, build the capacity of or train in a diverse group of stakeholders, law enforcement, primary healthcare, school systems, and we build cross-sector coalitions and partnerships with the financial, technology, healthcare industry, governments, and policymakers. Research informs all program design and implementation. At this juncture, I would like to highlight that we're moving away from using the term child pornography. While the term implies conventional pornography with child subject, it fails to convey the severity and true nature of these images. These are crime scene snapshots of the sexual exploitation and degradation of a child. Hence, the term child sexual abuse materials more clearly conveys the seriousness of the crime. Unfortunately, however, currently international as well as national legal frameworks still use the term child pornography. Next slide, please. Why are we focusing on online child sexual exploitation? In the 1990s, the American Medical Association first referred to sexual assault as a silent, violent epidemic. Today, these words decidedly define online child sexual abuse. Technology has changed every aspect of our lives, both positive and negative. New technologies are being developed every day, and unfortunately, offenders find new ways to use these technologies to harm children. And law enforcement around the world often does not have sufficient resources to keep pace. With internet connectivity and usage increasing year on year, online is where the risk is. 5 billion, or 67% of the world's population, is on a connected mobile device. 4.4 billion connect via the internet. The risks, hence, are numerous. And as these statistics show, 70% of the world's internet users are between the ages of 15 to 24. 1/3 of all internet users in the world is below the age of 18. And to our horror, the FBI has estimated that there are, at any given point in time, 750,000 predators online looking for such materials. Interpol, the organization that maintains a child sexual exploitation database, holds more than 1.5 million images and videos, and has helped identify 17,500 victims worldwide. Next slide, please. A quick snapshot of reports coming into the cyber tip line, which is the US hotline for reporting illegal content on the internet. In the US, electronic service providers and technology companies like Google, Facebook, Microsoft, Twitter are required by law to report illegal content that they may find or trip into on their platforms. In the week of May 26th, so that is from May 26th to June 1, the cyber tip line received 2,556 reports from the public and over 154,000 reports from industry, electronic service providers in the technology industry. Of these reports, we see 156,000 comprised suspected child sexual abuse materials just in 1 week. And to date, since March 1998, the cyber tip line has received close to 50 million such reports. So clearly, online child sexual exploitation is an issue. Next slide, please. At ICMEC, we research and publish reports, model laws, legal policy frameworks, and best practice guides on child protection. I will highlight just one flagship report: Child Sexual Abuse Material, Model Legislation and Global Review. Next slide, please. First published in 2006, we published the 9th edition in December 2018. Through the report, we aim to gain a better understanding of existing legislation in a country, to gauge where the issue stands on national policy and political agendas, and how a country is addressing this issue. In particular, we look to see if national legislation exists with regards to child sexual abuse material. Is there a definition? Are computer-facilitated offenses criminalized? Is simple possession criminalized? Are ISPs or electronic service providers mandated to report suspected child sexual abuse material? As you will see from our analysis, today, 21 countries meet all 5 criteria. 97 meet the first 4 criteria. 62 countries meet between 1 to 3 of any randomly these 3 criteria. And 16 countries still have no legislation around this issue. I'd like to mention here that the 6th criteria of data retention was not included in the 9th edition, because with the passing of the GDPR in Europe, it was a bit much for us to kind of put our heads around and include it in the 9th report. So as against doing a comparison between the first edition in 2006, there were only 5 countries that met all 5 criteria, the first 5 criteria, 22 that met 4 criteria. And at that stage in 2006, there were only 95 countries, and there were 95 countries that had no legislation on child sexual abuse materials. There, as you can see, there has a tremendous shift in the last 5 to 10 years. Countries have actively reviewed legislation pertaining to child protection, though in many cases we have a long way to go to ensure countries are implementing and enforcing these laws. Next slide, please. This segues very neatly into my next slide, where I highlight a cross-sector partnership. We work with the financial and technology industry to disrupt the economics of this trade. In any given year, 10 to 20% of this trade is commercial. This means offenders use payment gateways, electronic payment platforms, digital currency, mobile transfers, any means online to pay for such materials. First launched in 2006 in the US, the Financial Coalition is a powerful alliance between the financial payments industry, technology industry, together with law enforcement. And ICMEC launched the Asia-Pacific Financial Coalition in 2009 to broaden the fight against the online sale, dissemination of child sexual exploitation materials, and more recently, to the horror of all, the on-demand online live streaming of sexual abuse of children via video platforms. Banks, payment gateways, digital payment platforms are members. And ICMEC facilitates and is the catalyst that promotes and advances cross-sector collaborative action and due diligence within industry. I would like to stop here for a second and highlight one aspect which I missed in my earlier slide. I'd like to just highlight the key criteria of simple possession. In many countries, simple possession of child sexual abuse materials for personal consumption under civil liberties law is allowed. But production and dissemination is an offense in every country. So there is a disconnect here, as we can clearly see. If a person possesses such images, either he or she produced it or were party to an exchange. Very often, offenders see viewing as a victimless crime. This is far from the truth. By searching for such materials, offenders are creating a demand, and someone will step forward to fulfill that demand, in turn abusing children to produce these images. Next slide, please. Lastly, I'll highlight ICMEC's capacity building initiatives, specialist training, one of which is the subject of this webinar, which will come later. Law enforcement training. We do a range of workshops, a 101 on technology facilitated crimes against children. Very often, law enforcement, the average police officer will ask us, what do you want us to look for on the computer? We do basic training around computer facilitated crimes. We also do more advanced hands-on online training in real time, and train the trainer workshops to equip law enforcement to keep up with internal needs. Our most recent training was in India just last week in partnership with Interpol. In the last 6 months, in collaboration with UNODC, Interpol, and industry partners, or within a larger ICMEC program, we have conducted law enforcement training in Vietnam, Kenya, Peru, Barbados, El Salvador, and Panama. Both educators and healthcare providers are often the front line in child protection. When a child discloses the abuse, in school to a teacher or a school nurse, or in the community to a primary healthcare professionals, or doctors and nurses are often the first to notice a child in trouble. We partner with the Council for International Schools, regional bodies, and other stakeholders in the education community to offer training tailored to help empower educators to making sure schools have clear child protection policies and protocols to combat abuse, respond effectively, and report it. Every school should be a safe haven. On the healthcare side, despite important efforts on the part of the World Health Organization, the Centers for Disease Control, and other leading international bodies, there has been no comprehensive global effort to understand the problem as a public health crisis and to address it as such. Under the auspices of ICMEC's Global Health Coalition, a collaboration with the pharma industry and the medical profession, and the Global Initiative for Child Health and Wellbeing, a partnership with the public healthcare community, ICMEC focuses on giving child protection specialists the needed tools to increase the recognition, identification, and treatment of child sexual abuse. With this, I'd like to hand over to my colleague, Dr. Jordan Greenbaum, who will delve deeper into the risk factors, appropriate response, and needed support for victims of sexual abuse.
Thank you, Bindu. Before we give word to Jordan, I would like to thank you for this very interesting overview. I also want to remind the participants of the webinar to type in their questions into the chat box if you have any, and then these questions will be answered after the presentations. As Bindu has mentioned, our second presenter today is Dr. Jordan Greenbaum. Dr. Greenbaum is a US-based child abuse physician who is the Medical Director of the Global Health and Wellbeing Initiative with ICMEC, and the Medical Director of the Institute of Healthcare and Human Trafficking at Children's Healthcare in Atlanta. Jordan provides local, national, and international trainings on child trafficking and exploitation. And I would like to thank Dr. Greenbaum for being with us today. The floor is now yours, Jordan. We have little technical difficulties, and I want to warn all participants of the webinar that I'm unmuting all microphones right now. So please allow the speaker to start her presentation, and then I will mute your microphones again. Thank you, and sorry for that. Please, Jordan, the floor is yours. I have unmuted all participants. However, to be able to speak, you also need to unmute your own microphone. So please do so before starting your presentation. Jordan, we are waiting for you to hear your voice. Please unmute your mic. Indo, would you like to step in for Jordan, or would you like me to try to cover some of her slides?
Oh, wow. No, I don't think I could be able to step in for Jordan. One, I don't have her slides in front of me because I just printed out mine.
Okay, let me then start try to cover some of the slides provided by Dr. Greenbaum. I'm sorry for that. Of course, my knowledge around the subject is not as deep as Jordan's, but I hope in the course of this discussion we will be able to unmute Jordan's microphone as well, and she will be able to step in. The focus of Jordan's slides were on online solicitation for sexual purposes and so-called sextortion, also online child sexual abuse materials. In her presentation, Jordan wanted to highlight the importance of multi-sectoral approach in preventing and responding to online sexual exploitation. And the most important groups of the professionals who will have to work on this issue are social service workforce representatives, as well as law enforcement, healthcare, education sector workers, and representatives of a number of non-governmental organizations. So what are the risk factors for online sexual exploitation? This is online behavior, which includes also multiple risky behavior. Talking about sex online with strangers, also working or meeting internationally, embracing someone else online and doing it very frequently. Multiple strangers on buddy list known only online, and when the child doesn't know any of them in person. Also visiting X-rated websites internationally. For children, children who are at a higher risk of online sexual exploitation are mostly females, LGBTQ group representatives, children who are out of school, have disabilities, are living or working on the streets, represent marginalized groups, have mental health problems or history of abuse. Also, it's important to know about risk factors of parents, and these are mostly parents who are absent and unavailable for their children, parents in conflict with the law, pedophilic parents, the ones who have poor supervision skills, who are living in poverty, and the ones who have very limited knowledge about this problem in general. So what are the potential indicators of online exploitation? It's very important for parents and also special service workforce representatives who might be working with children to know about these potential indicators. No matter in what role are they working with children, because they might spot some of these indicators and respond to them early in the course of the problem. So spending more time on internet, becoming secretive about the use of technologies, becoming more possessive of their phones and not ever sharing it with their siblings or parents, agitated when answering phone, and needing privacy when they're dealing with their computers or phones, being unclear about new friends, and also started leaving home for short episodes without explaining to the members of the family where did they go. Some additional potential indicators are withdrawal when online, lots of new contacts or followers, also declining in academic discipline, mental health issues, pulling away from family and members of the family members and friends. It's also very important to know about the impact of trauma. When working with children who are at risk or are victims and survivors of online abuse, it's important to understand that children have changed views of themselves, and they have also changed views of the world and people around them. It's important to be aware about child and parent behavior, and not only watching for behavior of the children, to watch for things that children and their parents do, attitudes towards different professionals working with them, and also ways children and family members interpret some of the actions of children who might be at risk of exploitation. Our additional considerations talk about the importance of family members' trauma, because when members of the families, when parents themselves are victims of different trauma, they themselves react differently to their children's changed behavior. And also what's very important to consider our own experience of having different trauma, and how the experience of the social service workforce representatives in the past affect their own attitudes and behaviors towards children that they are working with. So how do we respond to these changed behaviors? It's very important to recognize the reason for changed behavior. And when trying to respond to it, we have to make sure that we ensure the safety of children, or do everything for them to feel safe in the environment where we're working with them. It's important to listen empathetically to children, and to allow them to share as much information as possible without interrupting them or giving them some directions or suggestions. Offering as much support as possible in any areas where they might be needing this support. So to say, meeting children where they are and monitoring signs of their distress. It's important that children who are in this situation need as much support from the professionals as possible. However, it's important for us to try to give some space to children, not to be very directive in our interactions with them. So what does trauma-informed approach means? It means that we have to be respectful with children who are victims or survivors of abuse, or even if we don't know about their current status, we think that they are at risk of abuse. It's important to give explanations about our plans with them. For example, when we're asking certain questions to these children, it's important for us to help them understand why these questions are asked, explain them that these are the questions which are meant to help them, and not because we're just curious about their situation. We need to receive children's consent before we start doing anything with them or for them, and it's important to do it in advance and not to make it as a surprise at the end of our interventions with children. They need to know if there is any information that we will need to give out to law enforcement representatives or make any actions planned in advance. It's important to be as transparent with children as possible and review the limits of confidentiality, as I have already mentioned to you. And social service workforce representatives would know that this is one of our roles with any client, with any child or adult, to let them know that if are certain risks of committing suicide or hurting others, we need to explain to children that there are certain limits to the confidentiality. What the strengths-based approach means when it relates to this group of children? It's important to engage with parents in evaluating the situation of the child and planning their care collaboratively. It's important to consult with them, no matter if we think if parents are capable of contributing to this care planning or not. Considering their strengths and their point of view is very important. We need to identify resilience in children and their members of the families, and we need to allow these children to have control over the situation and offer them as many choices as are available in that difficult situation that they might be in. Our next slide talks about prevention strategies. And when talking about prevention strategies, it's important to say that prevention has to be at all levels, being it primary, secondary, or tertiary. In our era of changing access to internet and increasing risks, as it was already mentioned by Bindu, it's important to offer knowledge and communicate information about these potential risks to children and parents in every case, no matter if the child is at particular risk in that situation or not. Also, there are some very important prevention programs for children which warn against sending sexual images. It's important for a child to know that it's not okay for anyone to ask them to share their sexual images. And the second they share the images, they could be at risk that some similar problems will appear in their lives. So they need to be warned in advance. It's useful to have children practice refusal skills and also role plays using scripts that children often believe to be helpful. It's important to talk with children about healthy relationships and hence helping them understand what is unhealthy in certain kind of relationships. It's also very important to target offenders and to warn of legal consequences of certain actions, because as Bindo was often saying, some of them don't often even realize that, for example, viewing this content is breaking the law on its own. It's important to teach peers to protect and intervene, to support and try to be non-judgmental and towards the victims, and also to discourage offenders as much as possible. It's important for our children to be informed about grooming techniques. A groomer may do any of the following things: send lots of messages, often using different platforms. We know that offenders are often trying to send messages to children by email, by Skype, by whatever means are available, so using different platforms. They are often asking children to keep this friendship as a secret. Ask questions about who has access to their computer and phone, so knowing the level of control that parents have over their equipment. Groomers often talk about sexual things, maybe make comments about body or sexual experiences, which is not appropriate at all with children. And also they ask children to send sexual images or do sexual things. And it's, as I've already mentioned, it's very important to help children understand that the second they send at least one sexual image to the stranger or anyone, it's out of control, and it will be very difficult to control the consequences. What are some additional tips for online safety? It's important to use strict privacy settings, and parents are often in charge and able to do that. It's useful to turn off location sharing, put out of ability for app or website to post on social media. And parents again can do it on behalf of their children. Take an interest in child's online behavior, no matter if they are finding that behavior strange or not, because sometimes parents might miss some signs. So it's important to be aware about our children's online behavior in any case. Some more tips. Begin good online citizenship trainings early. Do it as early as possible, because children are starting using internet and different platforms very early in this era. So don't and tell them not to give out their names, address, birthday, and some other details. Of course, not give out their email passwords and other passwords. Think before they post anything. What will be the impact of your post? Even if we want to do it today, what could happen as a result of that post in my life tomorrow? Texts and photos, they can be forwarded if needed, and we don't need to post them online. It's important to respect others, and if we are receiving any inappropriate requests, disagree politely. Children have to know that it's okay to say no when requests are not appropriate. Report bad behavior to their parents and to other trusted adults. And in that case, again, the role of the social service workforce representatives could be very important, because they are often the ones who are trusted by children that they are working with. Don't arrange to meet an online friend alone, because after building certain relationships with children, then they are often asked to meet these adults alone. And of course, it's very risky, and children have to understand some potential risks of meeting strangers alone. Understand the distinction between face-to-face friends and online friends, which is often very difficult for children, and also question whether information they get online is actually true or not. And again, children need help from the adults often from the social service workforce representatives or parents, in understanding all these important details. So what are the conclusions that we can make about this issue? There are many risk factors for online sexual exploitation, and they exist at individual level as well as the levels of families, communities, and societies in general. There are certain behaviors that we've briefly mentioned about, which may be indicative of online sexual exploitation and abuse. A victim-centered, trauma-informed approach in helping survivors is very important, and social service workforce representatives have to be aware about these approaches. And as we've mentioned before, because this problem is becoming more and more common, social service workforce representatives are more often ending up in the situation when they have to be working with the victims. And so they might be required to play a very important role in preventing online sexual exploitation as well as responding to it. So these are the slides which were prepared by Dr. Jordan. Most probably some of you have questions regarding the content that we have already covered, or maybe some additional questions to Bindu. So I suggest that you post those questions in the chat box. And meanwhile, I will also start by sharing some questions that we have received in advance of this webinar via email. So please raise your hand or please type your message in the chat box if you have any questions. And meanwhile, I'll start by reading some of the questions which we have already received. So first question is, can sexting be classified as form of online sexual exploitation? And of course, I will let Jordan answer this question. Give me 1 second to unmute her microphone.
Hello? Hello?
Hello.
Hi, there's a lot of background noise and an echo. I didn't quite hear the question.
The question was if sexting be classified as form of online sexual exploitation.
Yes, it would be. Yeah, because they are involved. They are essentially coercing that person to send more images, which is a sexual act. So yes, it would be.
We have more questions. Are the curriculum based on life skills type of training that have been tested for effectiveness? And if you could please talk about the trainings and share our resources about them. If you could talk about the trainings that your organization is providing, their content, and also how interested individuals or groups access the training.
I don't know if anyone can hear me, but the International Center provides a lot of training on trauma-informed care, recognizing and responding to child sexual abuse, and child sexual exploitation, including child trafficking. We provide training for educators, for healthcare providers, for social workers, and specialized training for law enforcement about cyber crime. There's kind of a wide variety of trainings that we do. We will give webinars, we have online materials, we will do on-site training. So it really sort of depends on the audience and the request. But in general, the trainings are all related to children and some sort of sexual abuse or exploitation or trafficking or missing children.
Okay, to some extent, maybe this question was already answered, but the question is if, as in many other fields, the ages from 12 to 14 are the best for implementing prevention strategies and trainings in order to prevent online sexual abuse in the case.
I would suggest that it actually is more effective if we can go much younger than that, start very early on, even at age 4 or 5, to start talking to children about body safety, boundaries, self-boundaries and boundaries other people have, healthy relationships, respect for other people and for oneself. All of those things need to be sort of ingrained in the child's basic learning early on, so that when they get to the point where they are extremely vulnerable as adolescents, they will already have this as part of their self-image, self-respect, and expect that of other people. So I think that the healthy relationships needs to be embodied early in a curriculum, as early as children can understand. Sort of as soon as they can learn their body parts, we start teaching them what is sort of private and what isn't. So early is better.
Okay, thank you, Bindu. We have also received an information from our colleague attending the webinar that they have implemented online sexual exploitation prevention project in Kenya in close partnership with Terdesom and with Childline Kenya. And it's very interesting and important to have similar informations, because sharing knowledge and experience from the countries in our region is also often found very useful for the members of the Alliance, by the members of the Alliance. So thank you for sharing.
I think that makes a really good point, that there is some great work coming out of Kenya with Childline Terdesom regarding this, and I applaud that. They are really doing good collaborative work.
Okay. Let's see if we have any additional questions from the participants. It is very unfortunate, and I have to apologize for that, that we were not able to share with you the wealth of knowledge from Dr. Jordan. However, we've shared her slides, and if you have any major questions, I think you could probably email us, and we will share it with Jordan for her to respond. If there are any more questions, we have a few more minutes, or if you, Bindu, wanted to make any additional comments. Meanwhile, I also want to remind you that this presentation, as well as slides, will be posted on the Global Social Service Workforce Alliance website and our YouTube site, and you can access this information anytime you will find it useful and interesting for you. Also, if any of you who are joining the webinar today are not the members of the Global Social Service Workforce Alliance, I want to remind you that for joining the Alliance, you can fill in the membership form on the Alliance website. Our membership is free, and as I have already mentioned, 2,300 people in 135 countries in the world are already benefiting in different ways from the membership of the Alliance, and of course benefiting each other from the wealth of knowledge from different parts of the world. Bindu, I think we don't have any additional questions, so I wanted to ask you if you had any additional comments or announcements.
Certainly, Natia, though it's been Jordan who's been responding to the questions you've been asking. She is finally online. I'd just like to add that, if there's the webinar attendees are welcome to write to either Jordan and myself, and we are happy to answer questions or provide them links to resources that they may be interested in. I would suggest that they go to the ICMEC website under our education portal. There is a whole lot of resources, yes, aimed towards the educational community, but in terms of resources for parents as well as children around the prevention and awareness side. There's also on our website, we have under our global training initiative, a catalog of training workshops that we have offered over the years. So they can get an idea of what kind of training has been offered elsewhere. And if there is interest, then as I think Jordan had mentioned earlier, we partner with a lot of organizations and would be happy to consider doing similar training for organizations that may be for which there may be interest.
Thank you, Bindu. This is very useful information, and participants of the webinar could see the website of your organization on earlier slides. So it would be really great opportunity for them to be able to access all the trainings and information that you have posted on your website. So please be in touch with us, be in touch with our very, very interesting guests and presenters. And we would like to thank you for your time, for joining the webinar. I would like to thank Bindu. Would like to thank Jordan, who unfortunately we were not able to connect for this collaboration, and we look forward to meeting with you again during other webinars. Thank you. Goodbye.
Thank you, Nadia.
Good.